I hear the government talk a lot about protecting the health and well-being of British Columbians. Thousands of people in my riding alone are without access to equitable, universal, primary health care. In the early days, the BC NDP embarked on an ambitious program developing primary care networks, team-based primary health care. However, the minister got bogged down in politics of the doctors and party politics. The unwillingness of this BC NDP to confront head-on the internal politics of physicians and the remuneration models with our constituents at the centre of their work, and the desire of the BC NDP as a political party to be able to announce patient attachment numbers or the need to celebrate ribbon cuttings, forced a change midstream. The focus went away from primary care networks and instead focused on health authority-run urgent care centres. The difference between these UPCCs and PCNs is big. PCNs, or primary care networks, create longitudinal care for people, whereas UPCCs, or urgent care centres, are more like walk-in clinics offering episodic care. I've heard from the experts in my community that the UPCC model has been disastrous on the delivery of longitudinal care for my constituents. Primary care providers locked into fee-for-service models cannot compete with health authority-operated UPCCs. Health authorities are poaching medical assistants and doctors, and yet they never have to show the actual numbers of these UPCCs. We hear the minister and his government tout the success, but they're not showing their work. How much does a patient visit at a UPCC actually cost? Is it $31? $250? How many people do they see in an hour? How many patients have actually been attached? Even though these questions are never answered publicly, in Budget 2022, this government is expanding the UPCC model by 26. How are we evaluating the success of the UPCCs? By the increased number of ribbon cuttings? Let me be clear, and I heard it from the family physicians in my riding. The primary care networks that the Minister of Health was originally invested in was a good model. It was just poorly executed. And I continue to hear that this ministry is increasingly autocratic. They don't listen to the advice from the grassroots. The program is top-down, paternalistic, not evidence-based, unless the goal is to destabilize primary care delivery in every community where UPCC's doors have opened. How many articles have been written about family physicians walking away from their practices? Frustration, exhaustion, anger, resentment are being repackaged as retirement. Let's be honest about what is happening to the equitable, universal primary health care in this province. It is being undermined and eroded because the minister and members of this assembly are more engaged in petty politics than actually evidence-based decision-making. Need I remind this government that very recently a government in Nova Scotia changed because more than 150,000 Nova Scotians didn't have access to longitudinal primary health care. This issue is motivating my constituents, just like it is motivating constituents across the Capital Region, Metro Vancouver, the Interior, the Coast, the Southeast, and the North. How did they solve this issue in Manitoba? Well, rather than autocratic, top-down decisions provided covered by slogans, they listened to the communities. They actually got down into the grassroots, provided funding for solutions that were developed for the people, by the people in the community. Instead of doubling down on an autocratic approach, in Manitoba they embraced a democratic one. One doctor in my community said to me that they don't believe this government cares for the health of its citizens. It's a doctor in my community saying that they don't believe this government actually cares for the health of British Columbians. How did we get there? How did we get there? How did we get there? You can say it's ridiculous, but how do we get to a position where that exists? It's time to build services from the ground up. Look, I can understand that this is an emotional topic, and it's one that conjures a response. That's something that the cabinet on that side of the table, the government on this side of the house, needs to reflect on. Because I didn't make that up, and I'm giving voice to people in our community that are speaking to it. So, if it's something that is conjuring an emotion within you, then you need to have that conversation around the cabinet table, because it exists. Pretending like it doesn't is a mistake. It's time that we build the services from the ground up, a community-informed response, rather than the top-down, autocratic approach that this ministry has been taking on this particular issue. What is outrageous is that this BC NDP government is now sitting on the sidelines while a corporate tech giant and others disrupt our universal health care model, entrenching access to the layers of services based on privilege. Back in 2007, this Minister of Health decried the Copeman Clinic for finding cracks in our policy to establish basic primary care accessible by all, and premium services available only to those who can afford the premium fees attached. To be clear, the so-called premium services, prevention, screening, access to diagnostics, were always part of a primary health care plan. However, astonishingly, this Minister of Health, who apparently believes in equitable universal health care, is justifying these changes by defending the fact that this company is BC-based. Sure, the minister will always be able to say to British Columbians that there is episodic primary health care services, walk-in clinics, in-person or virtual, paid for by billing the government. However, if you want premium services, then you must be able to pay an initiation, an annual membership fee for the Longitudinal Healthcare Club. Think of it like a private and public golf club. Even poor people can golf, but you need an ivory tower to golf in the uplands. What is the impact of the emergence of TELUS and others in the primary healthcare sector? Well, according to the healthcare providers in my community, they're also poaching medical practitioners and paying them much larger salaries than can be afforded by primary care providers working under the fee-for-service model. However, they're also picking and choosing their clientele, weeding through an extensive weeding out process. All the complex care cases, like the 90-year-old patient with everything wrong with them, the one that costs more than the clinic can recover, they're left out in the cold. If this is a people-centered budget, then the BC NDP have a different definition of people-centered than I do. It feels like the Minister of Health knows these programs are failing and that he is hoping that the likes of TELUS can sweep in under the radar and provide services that he is not delivering. Perhaps that's why he was so visibly shaken when I shone some daylight on this in question period. Well, he's going to have to answer for these decisions because, as one family physician in my riding said to me recently, quote, "There will be a reckoning. They should have listened to us, but they have ignored doctors for years," end quote.